Are the efforts that are going on here with the COMPASS trial and with other research that's going on going to be impacting some of these other issues? For example, the management of bone disease in multiple myeloma, anemia, infections, thrombotic events, and of course the adverse effects of therapy.
So remember what Deborah had said earlier, which was, in personalized medicine, when a patient looks at this, why do they care? They care because they want to believe that they're getting the most effective treatment for them, but they also want to make sure that they're not subjected to side effects that they're going to have to deal with for the rest of their lives. So yes, when we do the COMPASS trial, we're collecting all of this clinical data that we can go back and look at and generate hypotheses. What are we seeing in terms of how patients are tolerating treatments? What are we seeing in their genetic makeup, that makes them better able to tolerate certain drugs? And I think the beauty of COMPASS is, remember that it will generate a lot of hypotheses. But clinically, what's important to us is to work with companies like Millennium, say, well, what are the hypotheses we want to test? And then we can move to our clinical network, the consortium, to build out clinical trials that will allow us to, again, have critical mass and have really good, innovative clinical trials. So I think that's been the joy of developing collaborative models since 1998, is you keep generating hypotheses and you have the systems and the models in which to test them.
Right. And when you think about, the potential for reduction in side effects, it's not only knowing who to treat, whose disease is most likely to be responsive, but the data might actually show up who's at the highest risk of a given side effect on a given drug. And the other thing we can do about that is when we bring together rational combinations of therapy, sometimes you find you can use somewhat lower doses, therefore exposing the patient to less side effects. So I think there's lots of different ways that we can learn by understanding that biology of the disease better. It's not only about efficacy, but also about managing side effects.